Good afternoon everyone and welcome to this email video. My name is Neale Fong and I'm the President of the Australasian College of Health Service Management, and I'm bringing you this video to give you an update on where the college is in 2020, obviously in the maelstrom of the COVID-19 pandemic. First of all, I hope that each one of you, in whatever role that you are undertaking, either in the front line or working many hours in terms of the logistics and the organisation of leading our way through this crisis, that you are looking after yourself. Obviously, I'm not going to go through all of the precautions with respect to exposure to COVID-19, but more importantly, can you just please look after yourself in terms of your own emotional well-being, your relationships, your families, and ensure that we can maintain a healthy workforce as much as possible. The College Board met last week. In fact, we've met on a couple of occasions in the last 2 weeks, but we had a definitive meeting last week where we made the decision that we would cancel all events throughout Australasia over the coming at least 6 months and probably to the end of 2020, but we will review this depending on how the pandemic flows on. So all events will be cancelled, and we apologise for this. That includes the Perth Congress in October in this year, and we'll look forward to moving that into next year. We're also very aware that many of our branch staff and our national staff are working very hard, and we have instigated a working from home policy where they will not therefore be exposed to each other or visitors. So this is actually happening. We understand that there is going to be a need for us to increase the value proposition for you, our members and fellows and associate fellows this year. So I ask you and I plead with you to stay with the college. We'll be looking at how we can provide continuing professional development and education to you in other ways than in face-to-face meetings and in networking events that we currently do. We have made a decision as a board that our national webcasts, which have been very popular with our members and non-members, will recommence in a couple of months' time, and they will be free to all members for the whole rest of this calendar year. The board is also undertaking to review many other ways which we can provide access for you for professional development. So we'll be increasing the frequency of our excellent emailed list of resources and journal articles and reports that will be coming to you. We're also exploring how we can, over the latter part of this year, potentially instigate some learning sets, some groups where people can come together and do that virtually. And finally, I want to make a comment about the fellowship program. The fellowship program is continuing. We understand that fellowship coordinators will be looking at ways that they can make that virtual and work together through video conferencing and teleconferencing, and the exams will take place later this year. If you do have questions about your examinations and don't have the ability to fulfill the requirements in terms of meeting together because of your workload, then obviously we'll be very open to discussing that with you. The certification plans are on track. As you know, this is a crucial part of the college's growth, and that will be in place, but we will probably look at extending the period of where people could get themselves organised as an associate fellow to become an associate fellow into 2021, but we'll give you more information about that. Finally, can I just say again that please continue to be a member of the college. This is an important part of the Australian and New Zealand and Hong Kong and international health landscape. We are the leaders of the system at very many different levels. This is about staying together now and uniting to provide the right response to the communities which we serve. So on behalf of the board and our very hard-working CEO and all the executive team and all of our branch staff around Australia, stay well and let's stay connected and ensure that the ACHSM continues to thrive after this period of time. Many thanks.